The piriformis originates on the ventral surface of the sacrum, and then passes posteriorly of the hip joint to insert on the greater trochanter on the superior medial aspect. It is innervated by the branches of the ventral rami L5, S1, S2. Pictured in Gray's Anatomy are the ventral rami of L5, S1, S2. Blood supply are from branches of the internal iliac artery. The actions of the piriformis are a little different, where it will perform external rotation of an extended hip and abduction of a flexed hip. So looking at our model, this is our right hip anterior aspect. If the hip is in extension, piriformis will externally rotate an extended hip. If the hip is in flexion, the piriformis will abduct a flexed hip. The Gemellus Superior originates on the ischial spine of the posterior aspect of the pelvis and goes over to insert on the greater trochanter. It is innervated by the nerve to the Obturator Internus, L5, blood supply are branches of the internal iliac artery. The Gemellus Superior's actions are the same as the piriformis and the other deep buttock muscles to externally rotate an extended hip and to abduct a flexed hip. So on our right hip model, anterior aspect, this is hip extension. Gemellus Superior will externally rotate an extended hip. And this is hip flexion. Gemellus Superior will abduct a flexed hip. The Obturator Internus originates on the pelvic surface of the obturator membrane and comes over to insert on the greater trochanter. Its innervation is nerve to Obturator Internus, L5, S1. Blood supply, branches of the internal iliac artery, and the actions are to externally rotate an extended hip and to abduct a flexed hip. So an anterior aspect of the right hip, hip extension, the Obturator Internus will externally rotate an extended hip, and in hip flexion, Obturator Internus will abduct a flexed hip. The Gemellus Inferior originates on the ischial tuberosity of the pelvis and comes to insert on the greater trochanter. Its nerve is the nerve to the Quadratus Femoris, L5, S1. Blood supply is still branches of the internal iliac artery, and its actions are the external rotation of an extended hip and an abduction of a flexed hip. On our right hip model, anterior aspect, this is hip extension. Gemellus Inferior will externally rotate an extended hip. In hip flexion, this muscle will abduct a flexed hip. The Quadratus Femoris stands out from the other deep buttock muscles in its blood supply and action. But first, the origin of the Quadratus Femoris is on the ischial tuberosity, and we'll come over to insert on the quadrate tubercle of the femur. Its innervation is nerve to Quadratus Femoris, L5, S1. Blood supply differs here, where it is branches of the medial circumflex artery, and its actions are hip external rotation. Posterior view, the Quadratus Femoris will perform hip external rotation. So all of the deep buttock muscles insert on the greater trochanter. So we're going to go over the specific places on the greater trochanter where each muscle inserts. The anterior side of the right hip, the piriformis, the superior gemellus, obturator internus, the inferior gemellus will be here, turning the femur posteriorly. The obturator externus will be here, and the quadrate tubercle is where the Quadratus femoris inserts.